Today we are here in Kampala, Uganda, as one of our priority countries for the Collaborative Council, to meet members and aspiring members, and most importantly government, who have helped us to work in the Collaborative Council. So we are meeting to have a consultation over the upcoming strategy 2017-2020 for WSCC. Our expectation of this event is that when we share the propositions that have been developed over the months with the members of the WASH practitioners in Uganda, they are able to give us insights of the Collaborative Council's progress, if we are fit for purpose, if we are meant to do more and how we do it, and if our contribution in this country is actually attributable to any of the results that are being achieved in this country by practitioners and government.
We started with getting through the objectives of the meeting and understanding why we are here. And there were mainly 4 objectives, but the climax in terms of the objectives is really generating our inputs for the strategy. And then we had a very good presentation from Elizabeth from the WSSCC Secretariat, who further confirmed or provided us with more information on the importance of this meeting and our inputs into the strategy, but also reminded the different participants of their roles as members of the Collaborative Council.
My presentation this morning was targeting to make the members in the room aware of how important membership is to WSCC. It is very clear from a review we had in 2013 that WSCC has no business calling themselves a collaborative council unless it has members. And just not members, very active, fully engaged members. And most importantly as well is that the members determine how WSCC should look like, how WSCC should operate, and how the WSCC should be governed. It is the members who vote in the governing council of WSCC, known as the steering committee. I also set out to explain to the members in the room that it is them who will shape the strategy that is being discussed from 2017 to 2020, because previously the strategy that we are coming to an end, the 2012-2016 strategy, did not have wide consultation of the membership. So then for me, I was setting the pace for the day, that members' views are critical, that full engagement of members is important, that we value members as WSCC, and that is why we invited them to this meeting. And of course, I walked the members through the process that we are undertaking to develop the strategy of 2017-2020. Initially, we got 89 propositions, what people think WSCC should be doing. So from 89, we had different consultations, it got to 12. So the 12 were tested with the national coordinators in June last month in Tanzania. So we presented the 12 suggestions from the stakeholders to tell them, this is what the stakeholders are saying from the interviews, because we had 389 interviews, different people across the world.
And then the chairperson of the National Sanitation Working Group, which is also the WSSCC WASH Coalition in Uganda, took us through how Uganda is preparing, especially to implement SDG 6.2 on sanitation and hygiene, and also identified or helped us to remember the kind of challenges that we have already in the country and how these challenges are going to be addressed by different stakeholders. We also got a good presentation, an excellent presentation by the Assistant Commissioner, Julian Kyomuhangi. She is the Assistant Commissioner in the Ministry of Health and also the overall supervisor or the overall manager of the Uganda Sanitation Fund, the Global Sanitation Fund in Uganda, who gave us a breakdown of the journey, how the WSSCC started in Uganda, and specifically the Uganda Sanitation Fund from 2008 to date.
As you are aware, in Uganda, we call it a Uganda Sanitation Fund. But elsewhere, they call it a Global Sanitation Fund. This journey started way back in 2008. That's when I was a national WASH coordinator. And I used to go to Geneva for planning and budgeting meetings for WASH coalitions. And we were using our National Sanitation Working Group as a coalition. And then from there, the Water Supply and Sanitation Collaborative Council formed another department. It used to have 2 departments, formed another department for grants management. And then they wanted to give funding to countries. And after I had presented our Uganda picture, our Uganda profile, our institutional framework, our legal framework, the way we do business, they were really convinced that Uganda was the best to start with. So among the 7 countries they wanted to start with, Uganda was among them. But they only took 3 at the beginning, and still Uganda was among the 3 countries. So we have been implementing a Uganda Sanitation Fund through our structures of environmental health, right from the center up to the grassroots, using even village health teams. And also I mentioned how we did very well in the 3rd year, and when our donors came to visit us, we took them to Kumi, and they saw wonderful things, and they expanded the program and gave us more funding. So we are going to expand for the next 4 years after the end of 5 years. But this time government is going to put in also. The donor is putting in $2 million US, and the government has agreed to put in $2 million US. And we are taking over now, total 38 districts. Previously it was 15. We expanded to 15 more, to 30. Now we're expanding to 8 more.
By the time we're identifying priority countries to work with the Collaborative Council, we considered countries that had a very low human development index, and Uganda was identified as one of them. We have had several national coordinators, but currently we're on our 3rd national coordinator, who's the country director of IRC. So in Uganda, we are present in 2 prongs. We have the national coordinators work that is very critical at strategic engagement levels with government and lobbying and advocacy. And also we have the implementing arm of WSCC, which is the Global Sanitation Fund known as USF in Uganda.
The afternoon session basically concluded the one-day national consultations on the WSSCC 2017-2020 strategy in Uganda. And it mainly included group work, 3 working groups that discussed a set of questions. And the questions included what is the value addition, for example, of the WSSCC in Uganda? What should the WSSCC do differently in Uganda? What should the Uganda, the government of Uganda, the civil society organizations in Uganda request from the WSSCC in terms of capacity, in terms of information, in terms of all those things that can help really enable the WSSCC do things differently in Uganda. And we had very, very senior people, senior Ugandans working in the sector, the health sector and the water and environment sector, sitting throughout the day and participating in the group work in the afternoon. Having them there and participating in the group work was an indication for me that the work of the council is very, very important, and they would like to see more work done differently and in a better way. And they look at the 4 years to come from 2017 as years that will propel the WSSCC in Uganda to greater heights.
The members came up with the following. It's basically involving schools and institutions, like they had suggested in the morning, that involving the prisons. The 2 questions that my group and I focused on were, number 1, what can WSSCC, that's the Water Council, do differently in Uganda? And the members and I actually came up with issues such as working with institutions and schools, working with the private sector, building a fecal sludge facility. And the other question was that what tools and instruments can be used to implement the above. And it's basically, like with working with institutions, it's building a curriculum and investing in research with the institutions, and then working on monitoring and evaluation.
We have had research previously, but we have involved other institutions, and especially the northern institutions, the northern universities. although we have had a few southern universities to do some research work. But then we are saying, when you talk of research, what actually are we saying? We are saying that we should engage in more research so that when we are setting up WSCC as a knowledge hub, whether it is at the global level or at the national level, we have proper evidence. And just not evidence from our work from GSF, but also evidence from the sector and evidence from the academia. So then we are able to sell and sell it well. If it's our advocacy campaigns, they are of substance. If it's our work, it's work of substance, that we are able to be accountable for the work we are doing.
Promote learning and information exchange among members. Then engage in advocacy activities for WASH. Participate in the capacity building for WASH. Maybe if you have a training, you have a technical experts can come on board and support.
At Group 3, we realized that the Council is very important to Uganda, especially in the coming strategic plan. And some areas we highlighted where the Council can do for Uganda is through supporting establishment of the environmental health information hub. So that there is one-stop center about environmental health indicators for Uganda, national, regional, district, and village level. Then the second one, we proposed that the Council should support integration of institutions, especially prisons, into the ongoing Council activities in Uganda, because we were left out, and it's a missed opportunity where there is a big population which goes back to the community, and then those institutions, the prisons, the schools, and the secondary and primary, then the universities would be much more better to make us achieve the sustainable development goals.
This afternoon has been very, very engaging, very impressive, and I would say this has been a successful day. It is amazing the feedback we got from the members. They took in the propositions, they looked at them critically, and they gave us an amazing feedback. They actually unpacked the 6 propositions into the Ugandan context. And it's in line with what we've been discussing all along. We did not preempt them. And for me, it's exciting because it means we are on the same path, we are thinking the same things, we are sharing the same vision as WASH practitioners. It means that the Collaborative Council is not offbeat or off track, but is thinking with the membership. We have gotten nice feedback. We had questions actually lingering about, do we need to work in institutions? It is clear from Uganda that it is important we engage in institutions, what we've been referring to as extra households. How do we deal with schools? How do we deal with health institutions? How do we deal with prisons? We haven't thought of prisons before, so it's a big challenge for us. And I think we need to think deeper and also test it further with other stakeholders to see if WSCC is built for purpose to intervene in prisons.
To wrap it up, all for me, that this time the Collaborative Council decided to do consultative meetings. I think for me that was the real icing on the cake, knowing very well that the one that is ending in 2016, no consultations were done. So this was a great opportunity in the group work to provide inputs into a strategy, knowing very well that this is a strategy that will come back to us in the country. We will contextualize it, make it more Ugandan, and do the implementation. So for me, this day was worth really putting aside as a day for the national consultations in Uganda.